Listening to Planet Vero Radio. I am Cindy Schwartz, and this show is called Patient Partners. And I have on the phone with me from Indiana my friend Jeannie Roller, and we are patient partners. And we have decided to call ourselves that because we were thrust into serious medical conditions, serious medical surgeries, procedures, and that which didn't really turn out the way that we thought they were going to. And we both wound up with trauma and PTSD, and I guess that's going to be the focus of our show today. Jeannie, how are you doing?
I'm fine. How are you? I'm
good. I'm doing okay, yeah. So let's start off with that, Jeannie. You know, we don't have to get into the particulars. Maybe for a minute or two we do, but we want to say that when it happened to us, and you're the one that brought it up to me, I thought I was the only one that was like that this happened to. I thought it was crazy. I'm like, I hope this is a one-shot deal. I don't want it to happen to me. But please tell me this has never happened to anyone else, and that certainly is not the case.
No, it's not. And that was the thing. The medical harm actually happened to my husband, and I, too, as his spouse, am affected by it. And we just basically thought we were all alone in the world, that we were suffering in silence, and until one day I was just like, I can't stand this anymore, and I started looking, and I was amazed about how many other people have been medically harmed.
Mm-hmm.
That due to the internet, that people are now starting to talk about medical harm, whereas before no one really ever talked about it. But there are so many people out there who have been medically harmed that we're starting to talk and make a difference. And that's very important, because that's part of the healing process, is to be able to talk to others. You may not have suffered the same type of harm,
mm-hmm.
but there is kind of a sisterhood and brotherhood in knowing that there are other people like you that have had medical harm. It's not a good club to belong to,
mm-hmm.
but it does give comfort because they do understand the trauma that you have endured.
Right, and so you're absolutely right. We have been banding together. One of the statistics that I found 2 years ago, when I really started delving into what actually is patient harm, what is medical PTSD, what is medical trauma, and his name is Dr. Monk, and he is a PhD doctor at San Diego State University, and I want to say his statistics are at least 1 million people per year in the USA are suffering from this medical harm and this medical trauma, and those are the reported cases. So it's like rape, where a lot of it does happen, but a lot of people don't report because they're ashamed. They don't know what to do. They're scared. What do you do with something like that? I mean, it's your doctor, for crying out loud.
Right. It's medical professionals, nurses. People
right.
don't believe this type of thing happens. And when you report it to the appropriate medical board or whatever, they just kind of brush it away. It never goes anywhere. You report it to the hospital, patient advocate. Their job, they're being paid by the hospital. Their job is to get rid of it, not to let it get out. So, I mean, everywhere you turn, you meet a wall.
So what did you do? Did you go through that whole channel? I know I did, and I can say in a minute or two what actually the people that I talk with, is that what you did, trying to get help? And how did that work out for you? How do you feel, afterwards, knowing that nothing to date has been done?
Well, we feel really victimized, even more so than the actual crime, because now we've been harmed, and there's no one willing to help us. And that hurts. That hurts a lot. That makes the harm they did even that much worse, knowing that you're a non-person, that you're not important enough for anyone to care about to help.
Mm-hmm, mm-hmm.
It is something that causes even more in the PTSD, because you just feel helpless.
And you can't rationalize it. In my own instance, mm-hmm. I can't rationalize that medical people, that a surgeon did this and allowed this to happen, when that person's answer was, well, you didn't die.
Yeah.
I mean, that
Well,
person said, go ahead.
Well, for my husband, they said that since he's getting older, he should just get used to being abused.
Serious?
Because he's going to have more medical encounters. Like, seriously? I don't think so.
Well, that's just obscene.
Mm-hmm.
I mean,
that's what the patient advocate said.
And so, just real quick, Jeannie, what was the channel that you went through? You went to the hospital. You went back to the hospital. You talked with I don't want to put words in your mouth. You talk with the doctor. So just say real quick what you did.
Well, we went through the hospital channels. We went through the Indiana State Medical Board. We went through Health and Human Services on a national level. We went through CMS. We went through everything. And basically, everyone said, well, it's not in the medical record, so it didn't happen. Because I guess if a criminal doesn't make a record of what they did, it didn't happen. So it's just, I don't know. There's hardly any words to describe it. It's just like you cannot believe that this can happen, that they only investigate when there's like 500 or so patients that have been abused. Mm-hmm. It's unbelievable.
I don't know if there's really a number, because one of the most recent cases that that we're seeing in the news is the one about the doctor, and I'm going to forget all the particulars, and I apologize for that. But it is out in California. I want to say that he was at the University, it was Southern California, something like that, and he's a GYN doctor. Go ahead. Mm-hmm. Yeah, and it went on for 30 years or 30 plus years. There's also the famous one too, and not great famous, with the doctor for the Olympic team, and how many years did that go on? And those girls didn't know. Like, patients don't know. We don't really know what to expect when you're facing surgery. We really don't. No,
and most people will brush it off like, that didn't really happen, did it?
Or why do you think or why do you think that that's so, bad? I mean, we do this every day. Well, we don't do it every day, though. And I'm not talking about, and I don't think you are either, Jeannie, I'm not talking about, they're supposed to roll out the red carpet for me and I have like a plush ermine jacket on and, we're not talking about that. We're just talking about basic human rights where you're not stripped naked, kept naked, you're freezing to death, you're in a room full of people, they keep shooting drugs into your IV at each turn that you ask for help, and you're just objectified, jeered at, scoffed over and made fun of, and it's not even so much that, it's just the lack of you being a human being.
Well, and it's that you're used as entertainment. They may use their personal cell phones to take pictures if you have something they term as interesting to show their girlfriend, their boyfriend, their neighbor. You don't know. You have no control, and that is so scary. That is so normal to them that you have no control over it. Mm-hmm. I just shake my head and think, wow, how many people have been abused and don't know it?
Well, and that's happened too in another recent one. So hopefully this will start breaking out. We've got like a minute and a half left, and I want to get some contact information out there for the listeners. But the case where they've now redone the pelvic informed consent paperwork because so many arbitrary pelvic exams were done on male and female patients after they were under, and these people were there for hand surgery, foot surgery, leg cath, whatever, and they were just objectified and basically raped, as far as I'm concerned. So those are three cases that people should keep in the front of their minds that, we are telling the truth. We're not making this stuff up. So I want to say real quick, Jeannie, go ahead and give your Twitter handle, and then I want to give kudos to Misty Roberts at Medical Patient Modesty, who has helped us both. Go ahead.
Okay. On Twitter, I am at Rights for Patients. That's the number 4. Please come and join. Tell your story. There's always someone there to listen. So that's the best way that I have found to try to deal with what has happened, is to talk about it.
Yeah, it is. You should definitely talk about it because we are telling the truth. Misty Roberts is at patientmodesty.org, and she is also on Facebook at Medical Patient Modesty. Thank you so much, Jeannie, and I will say goodnight, and we are going to be patient partners ongoing.